Remember, we have more deeper analysis with my panelists here in studio shortly from now. But first, after months of vaccine shortages that left parents anxious and newborns vulnerable, Kenya has finally received a shipment of life-saving vaccines. Dr. Ouma Oluga is the Principal Secretary for Medical Services, received the consignment on Wednesday, that is June 11th, which included 3.2 million doses of oral polio and 3 million doses of BCG vaccines. Mary Mwoki reports.
Kenya has finally received a long-awaited shipment of life-saving vaccines after months of critical shortages bringing relief to thousands of parents whose newborns and infants had missed out on the jabs for more than 3 months. The critical consignment of 3.2 million for polio and another 3 million for tuberculosis preventing BCG vaccines, and in months of nationwide shortages that disrupted immunization for thousands of infants.
The reason why vaccines are being procured also through UNICEF is for the sake of efficiency. Remember, UNICEF does this for all the other countries, and because of our what we call a partnership financing agreement, or the PFA, with Gavi, you have to then work with a procuring entity that then can collect with the manufacturers, can make sure that they aggregate the quantities.
For weeks now, healthcare workers had no choice but to turn mothers away. This talkout raised alarm as children missed their first most critical vaccine in the weeks after birth. The ministry is launching a nationwide catch-up campaign from June 15th. The vaccine will be dispatched to 9 regional depots for immediate distribution across the country.
The National Treasury and ourselves, we have agreed in principle that certain budget lines, including vaccines and immunization programs, will never again be subjected to budget harmonization and rationalization and supplementaries. That we have an assurance from the CS National Treasury and his team. So that never again we will have some delays in terms of resources. We must always keep the Kenyan child safe by giving him the right vaccine at the right time.
To reach the thousands of children who missed their jabs, community health promoters will help identify and refer families to nearby clinics. At least 80,000 children are estimated to have gone without immunization during the crisis.
Cases of polio saved millions of lives from deadly diseases such as measles, influenza. But yet, despite these successes, many preventable diseases continue to threaten our population, and especially the vulnerable communities. I want to urge the community health promoters to go all out and get the mothers, the caregivers, so that they can take their children for vaccination to ensure that we save lives.
Made great progress. Out of 100 Kenyan children, 80 are fully immunized for the basic antigens. That is BCG, polio, DPT, and any dose of measles. As a result of this, 7 out of children born in Kenya live to see their first birthday.
At least 12 counties have completely run out of essential vaccines, with vulnerable populations in border regions and refugee camps hardest hit. Parents whose children missed their BCG or polio shots have been urged to visit health facilities from the 15th of this month. Mary Mwoki, Citizen TV.